Not longer than an hour.
Okay.
Okay, we are live now. Welcome everyone. This is to our Communication Talk, episode 9. Today our title is Humanism and Pandemic in a Communication Perspective. And this is Mumtahin. I'll be hosting our talk today. We are still going through the pandemic, and the COVID-19 has changed our life in so many ways, and especially in how we communicate to each other. So today we are going to talk about the communication perspective of human activities during this pandemic. Let's welcome our guest. We have Dr. Abul Mansur Ahmed, professor at the University of Dhaka. We have Dr. Sudhamshu Dahal, professor at the University of Kathmandu. We are still waiting for our other guest. We'll welcome him when he joins. Welcome to you both. Thank you, and we're very happy to welcome you. Let's start with Dr. Mansur, if you allow me. So we are facing a different challenge that we can no longer communicate in face to face, or our communication now has this challenge of physical presence. So how is that affecting humanity during this time in general? How is it affecting human activities, humanism?
Thank you, Mumtahin. Actually, we are going through a very difficult time than ever before. And particularly, you see COVID-19 is much more than a health crisis. And it has the potential to create devastating social, economic, and political crisis. And you see that people are going through trauma, stress, fear, and anxiety. And actually, it requires psychological intervention for mental health. And when it requires psychological intervention for mental health, actually it requires face-to-face interaction. Sometimes you cannot mitigate that problem by online tools. And you see that the communication in the family, people are going for self-isolation, or some members are quarantined. But then they need some comfort. They need some association. They need some kind of empathy, that the other family members can take themselves to the position of the other family members. And you see, this pandemic has created some social alienation, that has created some loneliness. And in human communication is always we call that communication plays a major role in our life, and communication is an exchange of ideas between the peoples. So I always emphasis on face-to-face interaction, but pandemic has changed our lifestyle. People are using devices. People has more dependence on technology. 4 or 5 family members, they're living in the same house, but they're communicating each other through technology. Even they try to exchange their information within the house, using social media. Even they send message each other to move to the dining table by giving a post, and someone gives like other member says that let's move to the dining table. It's all happening. And I would say coronavirus has created that challenge. And people can say that I don't need to meet other people's in person. People can say that meeting people in person is a very traditional way of communicating other people. But that is the foundation of the communication. Face-to-face interaction is a more effective mode of communication than any other communication. We want to mitigate the sufferings of the other people, those who are infected with COVID-19. And in that situation, you see that actually we can build empathy by engaging with other members of the family, being aware of the needs of the other family. Actually, it's very important to get more connected with the family members, and it requires interaction. And interaction is the bottom line. And you see, lack of interaction is creating loneliness, and eventually it's creating frustration. And people are going away from other members of the family or the community. Even you think that corona pandemic started basically in March 2020 in Bangladesh. And in Bangladesh and around the world, lockdown was imposed, and people started staying at home. Particularly, first couple of months, people were in full compliance with the lockdown. And you see that people are not habituated to stay at home. And you know that staying at home has enhanced domestic violence among the partners, among the family members, among the siblings. And even you see that this pandemic has created a huge educational disruption within academic arena. You see the global calendar has been thrown into a state of disarray by the corona outbreak. Students have returned to home, to their parents, and together self-quarantine. Convocations, graduations have been cancelled. Classes have been cancelled. Some examinations have been cancelled. University research programs have been postponed. So you see that it's a huge disruption. And I would say that face-to-face interaction has no other alternative to mitigate the sufferings of the people and create more empathy for the people, for the community. And you see that during this pandemic situation, people left the dead body of their family member, just out of fear and anxiety that that person can get infected. How can you imagine that how family members can leave their another family member? And so it's very important to um, get connected with the family members through interaction and through uh, 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 get connected, and particularly mm, device or technology is creating uh, a lot of uh, disruption uh, within the uh, perimeter of face-to-face interaction, and people are moving to the virtual communication. And you see that children, parents live in the same city. Children, they don't like to visit their parents' house. They like to make a phone call or uh, WhatsApp or other tools to communicate with parents. So Professor Dahal was saying in the beginning of the discussion that's about the impact. Impact is huge. This pandemic, the impact, we can feel the impact for next 5 years, 10 years, a decade, or more than a decade. But we need to overcome this challenge by enhancing our empathy, showing respect to other people, showing love and affection to other people. We need to enhance our human values, love, affection, sympathy, empathy in our everyday communication. Simultaneously, we need to enhance public values. Tolerance and mutual respect are vital component of public values. You see, COVID-19 pandemic, it's a critical situation. It's a crisis. During the crisis, people should be nice to each other. Sometimes people can get impatient, intolerant, but the other people need to overcome that situation. You see that the person who is living next to your door, that person could get impatient, intolerant. But you need to understand. You need to take yourself to the position of your next door. And that's the way to create a sense of community and a sense of empathy. And that's the way to get out of that problem. That's the way to bring solace to the sufferings. And I would say that face-to-face interaction is the bottom line to overcome this pandemic situation, to overcome alienation, social alienation. That's all for my answer.
Thank you, sir. I couldn't agree anymore. I mean, I can just give a tiny snapshot of my experience being abroad all alone. I'm already far away from my family, friends. And when this pandemic hit, there's no classes. So most of my interaction with, like, say, in personal interaction, our face-to-face interaction with people is through my education, like through campus, like on campus, because of my classes, either when I teach or interact with my professor or my students. And that is no longer happening. Most of the classes canceled or going online, and forget about like socializing with friends or hanging out or anything else. On top of that, like I'm scared if I'm gonna get affected because it's already in the beginning. So everything is so scary. I'm worried about my parents back home, my family back home. I'm worried about myself. I'm alone here. I don't know if I'm getting affected. What am I going to do? On top of that, this tension, if I'm gonna be here at all or not. Am I going to be deported as an international? What is going to happen? So you can imagine, like it was really hard, and definitely I totally agree that it can have a toll on our mental health as well. So linking that to, I'm going to, I have a follow-up question to Dr. Dahal. So we try to adapt to this online communication, and even when we are having some in-person communication or face-to-face communication, we can't even see our faces most of the time. So how is that affecting our relationship with each other? How is that affecting human relationship?
Uh, First of all, thank you very much for inviting me to this platform to talk about, like a very uh, pertaining issue in a pertaining time. So we are all in the pandemic, and then this has had, as a professor just narrated, that how why we need to have a more empathy building during this time of crisis. And nevertheless, we have this advantage in the technology, which will help us connect to each other. But this technology, the developed so far, has been very individualistic. So it does not have that communal. It is not built into that communal, like system, because it is not built by us. By our, like cultural instincts. It is so Western, and the Western has been very individual. Like from past many decades. And then maybe it is the time to revisit that and see when, even we call it the face to face, like communication, and even some tools are named as face. Like there is this, Apple app. It's called FaceTime. Like, so you just FaceTime each other. Like, so you bring in the time and you bring your face together and then talk. But it won't happen so simply, because uh, as a human we are very complex, and we are also so much nuanced in our lives, that it will be kind of, like, we are very adaptive, but still this adaptation takes some time. And this pandemic was kind of, like instantaneous. Instantly it came, like we all go back to the same date, same month, at least March 2020, where we all kind of were, like, was overshadowed by this coronavirus. And then the life completely changed, and it's still being changed. And on the one hand, you see people are not following what they're supposed to do during this time of crisis, as a personal behavior, health, like aspects, as simple as, like covering your face, covering your nose and mouth with a mask, and exercising the social distancing, and not to visit the crowd, like, and then or washing the hands, or trying to sanitize yourself as much as possible, and and flaunting all this in the name of, like their own, like desire, or their own, in the name of their own wishes. So this has been a little problematic. So when this face to face communication has no faces now, even we face that a lot, because if you ask me, from my experience as a professor in Kathmandu University, we kind of immediately bandwagoned to this virtual teaching, as the lockdown was imposed in Nepal on March 24th, 2020, this year. So immediately into 2 weeks, our classes, particularly for my school, the School of Arts, were online. And then we conducted these classes. But what we often come across is that it was this medium was like not designed to become, because the class itself is one aspect of like communal activities, where it's a community activities. And but this tool is so individualistic that people would just go on like as they wish. Like when, like for example, when you're having an online class and some of the students, like maybe you are in a group of 20, 25, some would not, some would never come to open their videos, because they're not accustomed to that, because they might feel it like it's a, yeah, it's just to do like that. And maybe they were they didn't want to disclose their positionality or the position, or maybe when they are at home they don't want to show that, or not to show the face, but nevertheless participating. So then the obvious question comes as, is was that, or is that a participating, is that a participating, are we participating even in this online form? And as like as we've been discussing about what would be the like human suffering, and what would be the communication angle to this pandemic, like, so more than a health issue, this pandemic has become a societal issue. Like, it's a larger social issue. It has brought in so many like ruptures into the society, and it has also shown how our society was like, or has been so loosely held, maybe, if I could interpret in that way, like, so although we talk about the very strong ties, strong bond, like the celebrations, the values, the systems, like, and then the empathy and things like that. But this pandemic has really shown one aspect where our society has been so loosely connected, and it was loosely connected to become individual, and then the individuality was on rise. So maybe this is the time where we could visit and see or kind of inject more of these communal values or community values among ourselves, so that like we can understand each other better, like, and then maybe I won't have a very like kind of a pessimistic view on this, on the impact this technology would play. Rather, I would have an optimistic eye. These technologies could be complementary, but we have to kind of like evolve with this. We might need to redesign our own purposes of using it. Like, how do we use that? Like, you cannot connect because you cannot be physically close because of this pandemic, because of this virus, like, because of the fear of infection. But at the same time, you need to get connected, because otherwise your life would be in jeopardy. So these two challenges, I think we have to kind of evolve between these two situations. And I was wondering, like, this is what I was discussing in the beginning also, in the maybe in the 0 hour session. What would it be like when this the Spanish flu hit the world in during 1918, like the very first decade of the 20th century, like, so how would people cope in those situations? The life was much simpler than that of today, and that the technology was much simpler, whatever technology was available, that, but nevertheless people were the same people, like, people were doing their kind of progressing, and we are also progressing, like, until the March 2020, on our own style, on our own fashion, on our own speed. And maybe this has given us a halt, or given us a time to rethink, and maybe pause and think, like, were we developing, or were we in that path of so-called progress, a very tiny, like, the medical experts say that this is not that dangerous virus, but it has been so effective, so this tiny virus has kind of halted all our activities. So is it the time to revisit human communication? Is it the time to revisit what we value for, like, and how we were evolved as the human? I think this much I would like to say for now.
Thank you, Dr. Dahal. I totally agree. Like you mentioned, like how much it has affected, like how like the more individualistic the communication is rather than um, community based, we are losing that tie. It's more individualistic. So I have a quick follow up question to you. Uh, then so since like we're adapting to these new ways of communicating, or we are putting more emphasis on a different way of communicating, how can we be more effective, or what approach can we take, or what strategies can we take to be more effective in the ways that we are communicating now, in different situation, like either for the doctors or for the teachers or for family members. How could we be more effective?
Yeah, I think, especially as you mentioned, the doctors. I think they are frontline workers, and then they have been affected. And then they have been the effect had been tremendous on them. But at the same time, I could see everywhere in the world, including in my own country, how they are coming, like frontline and using the communication tools that is available to them. Now the doctors' tweet these days have been, has been on rise. So more and more of the doctors are tweeting about the behavior that is the general public should follow, and the seriousness on this pandemic the policymakers should take, and and the support that is required to these caregivers, and the support from the society, support from a general public, and support from the policymakers, support from the government and everybody. So maybe this type of communication strategy we might need to craft into, or we might, this is what I was mentioning about evolving a way of communication. Like maybe we have to evolve a new way of communication within this, because it has been so individualistic, like even now, as a professor rightly said, that even sitting across the dining table, people, rather than talking face to face, eye to eye, and they would talk through this mediation of their mobile phones, so this computer mediated communication, or the technology mediated communication, has been there, and it's been so pervasive, and it's been very effective, and then it's affecting every one of us. Maybe this is the point, or this is the tool where we could evolve from, maybe the one way could be, to control or to curtail the misinformation, like how easily it could spread. Even this afternoon, some of my students, they were presenting their findings from the research they have conducted in past 6 months during the COVID time, about the use of communication on different aspects of human life. And then particularly on the one that was very interesting was on the misinformation, how misinformation could easily be, transformed. And one student's research talked about, like the fake news and the deep fakes, which is a completely new phenomena for us. Like, so people were completely ignorant about the effect of fake news to them. They could identify that as the fake news, but they were completely ignorant. So you can imagine, any fake news, fake information related to this crisis, could be devastating, for not only for the person, but the families, like for the community as a whole, or even for the nation as a whole. Like, it could have a multiplier effect in that. So maybe one aspect of looking into it would be to have a proper communication to flow from these channels, whatever is available to us. If you look at the mainstream media and its power, as well as its position in the society, has often been questioned, challenged, but nevertheless, kind of surrendered to, or we all rely on that. In that meaning, I was using that word surrender. So we will surrender to their power. So if they wield that much power, so maybe this is the time they could think of their own responsibility as a communication person, as a media person, to to counter these misinformation or the fake news, that not only on the health aspect, dealing with the COVID-19. So there are so many aspects to the COVID-19. Like, generally, I think the world has come to understand that COVID-19 is not only a health problem. It is a larger social problem. So if it is a political problem, it is an economic problem. So if it is a larger social problem, then maybe the information that is related to COVID-19 would have a larger social impact. So I think maybe this is that should be the bottom line in our strategy making or strategy for formulation. And if you ask me as a communication scholar, I could see kind of kind of like ray of hope, or a light in the tunnel of this darkness. Like, so where we could, this is the time where the communication scholars could think of coming up with this, like kind of a new model or adaptive model or evolving model to address the problem that the human are facing, or maybe trying to do more from the aspect of the human communication, rather than like promoting the individual communication. Yes, individuality is there, but now you can imagine, like the well, I can give you one example. In, I think everywhere this happened except in some countries. The new movie release, like they cannot release that on theater. People are not going to the theater, so movies are being released on the individual platforms. Nevertheless, the way the movies are being released, and the promotions for the release has been done, it is taking the very old approach of, like kind of watching together, viewing together of those movies. Like, so if that is what we need, that means coming together, like being together, the togetherness, understanding each other, then maybe if that is not possible, if that is restricted, because priming our health is important over any other aspect, if that is the case, then we might need to evolve a new pattern, a new strategy, like which could nevertheless, like prime the human aspect or the humanity. The humanity would be at the core, but but taking the real assessment of the current situation. And maybe who knows that coronavirus, this particular COVID-19 is there now, like, and then we might be able to find the vaccine, because the news, everyday news is coming up and giving us a hope that this has 90% success, this has 95% success. We might get very soon 100% success. That is my hope, my desire, my wish, like. But what if you get this 100% success on one vaccine, and then you find another virus emerging, or another same situation happens to the humanity? So I think we have to open our eyes from the humanities or the human perspective to look into this problem, and maybe try to find a solution within this problem, to prepare us for the future, to deal with the future problems also. So maybe like communication could be a way through look into that, because communication not only, like helps you assess the current situation, but it will somehow help you see a future also, like, so, or it might also help you craft some part of the future. So if we are thinking about, like behaving in a certain way, and will have certain consequences, because there have been tremendous research on the behavior change communication. So if we could model that and predict that within this crisis, I think we would get some strategy. But whatever I say might not be, like 100%, like 100% proof, and or it might not be 100%. But still, like as a human, we never give up. We keep on exploring, advancing. Maybe this is the way we should think. And the primary, like the question, and I think the topic of today's talk is also about, like priming the human, like aspect or the human communication, even through this digital communication, and even the overcoming the barrier to the human communication posed by these new communication technologies should be the priority in our strategy.
Thank you, Dr. Dahal. Thank you for mentioning that, yes, the media has a lot responsibility, especially now, and also, you know, also like expressing some positivity. Like we don't want to be so pessimist right now. We still need hope to go forward. Thank you for that. And I wanted to go back to Dr. Mansur. Mansur, sir, if you
Yeah.
allow me, I have a follow-up question. You mentioned about you expressed some doubt about how it might look like in 5 years, 10 years. So um, I wanted to ask a quick follow-up question on that. So when we go back to normal, and I don't know how that would look like if we would ever go back to where we were, how that new normality would look like, but if we go back to where we were, as far like we don't have the pandemic anymore, but the changes that we experienced with the adoption that we took for communication, how do you think, like, where would you stand in that after COVID time? Like, would you still like would our communication be like pre-COVID, or would we, because we adopted, now we are gonna move on with this new system?
Um, Thank you, Mumtahin. Um, Actually, we are going through a new normal situation, and pre-COVID uh, and during the COVID pandemic, and once it's gone, we'll move to the post-pandemic situation. You cannot say it's completely gone, and that would be the another new normal situation that we'll uh, try to overcome. And you see that communication pattern has changed, and particularly last 7 8 months has changed the behavior pattern of the people. It has changed the behavior pattern within the family. It has changed the interaction pattern in family communication among the family members, the way they behave within the uh, family. And actually, it's not easy to go back to pre-COVID situation. I think uh, this COVID may have a greater impact at the at individual level as well as community level. And you see, Bangladesh is within the top 30 affected country. During this pandemic, Bangladesh has gone through social stigma, fear, and anxiety. And you see the primary healthcare treatments in the hospitals and private clinics were disrupted uh, in the lockdown. Many emergency service providers, such as frontline doctors, healthcare staff, caregivers, police and armed forces, bankers, and government authority were infected, isolated, even died. Private practitioners, cleaners, clinics, hospitals in suburban and rural areas were shut down due to the fear of infection. And still you see the fear of infection, it drives the community, it drives the whole society, and people are very uh, uh, very sensitive to each other. And I could tell you, I was visiting an office. I went to see an officer in a government office. And um, uh, in the beginning, he was telling me, please stay away from me. Although I was using mask, so you see, it's a very different phenomena. It's a very different situation. Now I'm giving you another example. I went to my hometown a couple of weeks ago. In the morning, I was walking. A couple of elderly people asked me, "Hello, when did you come from Dhaka? Are you okay? You're using mask?" Those elderly people were not using mask at all. Even they were suspecting whether I'm having COVID infection. It's so you see that how people see the things. It's quite different. And so I would say that the behavior pattern is changing, and people are becoming more aware. I would say a section of people are becoming more aware about their health safety. They're more aware about the health risk. And I could tell you that I noticed that some of please.
Sorry, do you think like that fear we would carry that even long
Yes,
after we
yes,
fit COVID?
it could we could carry that fear longer. Even it could happen on board the flight. You're sitting next to a person, and that person may not feel comfortable sitting with you, because you see, it has created a social stigma. It has created a social anxiety. And how can we just overcome that situation? I would say feeling empathy may allow us to manage anxiety in better way. And I would say we need to stay connected. We need to be aware, and we need to be kind to each other, and we need to be considerate to each other. And that's the way to build up the sense of community. Otherwise, that can create a lot of chaos in the society. That can create a lot of problem in the society. People can mistrust each other, and you see that online classes are going on, and I would say that online teaching is an ad hoc solution to this crisis. And how can we motivate students to read a book? How can you motivate a student to complete their reading? Is it enough that I will upload my video materials online and a student will visit that video and they'll go through that video stuff? And uploading PowerPoint stuff is not enough to enhance online learning. I would say the word within quotation, ad hoc solution. But that's the reality. We are going through that situation. And students, you see that they cannot come and see their instructor, professors. And In most of the cases, they try to communicate using their devices. Uh, and in most cases, I would say it's not effective at all. You can say, this, sir, you are talking like a traditionalist. But I would say online teaching has changed the uh, learning paradigm. You see, we have a very different online pedagogical approach. But I would ask Mumtahin that you are studying, you are a doctoral student in the United States, that in most of the cases you are attending online uh, classes, online courses. But you see that in most of the cases, you are going through some difficulties. You need to consult with your instructor. You need to consult with your professor. But online is not enough. I would say technological advancement is going on. Marshall McLuhan used the term technological determinism. Technology shapes the lifestyle. Technology shapes the society. Technology shapes the community. But the question is, how do you behave? How do we use that technology? Is it making us isolated? Is it creating alienation? So I would say that it's very important to bring some striking balance using technology as well as enhancing interaction, collaboration, and bringing compassion to interact. And I would say that you see that this pandemic situation, I would say there is no medication and vaccination yet. We don't know when we are going to get the vaccination. And politics is going on around the world. China, Russia, UK, USA. It's all about marketing the vaccine. We don't know. We can get vaccine in the beginning of the next year, or middle of the year, or end of the year. Now there is a question about the effectiveness of the vaccine. Some claim 90%, some claim 94.5%. And you see, during this pandemic situation, people used disinfectant liquids, garlic, lemon tea. Is among the many misinformation to cure COVID-19. So you see the fear of infection, quarantine, social isolation, a lack of self-care, that created a lot of problem for the individuals as well as the whole community. And the question is how we can overcome. I would say it's very important to enhance generosity, be kind to each other. It could be using technology or face-to-face interaction. And this very important. It's very important to show caring attitude to each other. People should not go away from each other, because we see during the pandemic situation, people are showing their hatred. People are showing their attitude to each other. in communication, we would say it's very important to uh, sharing the experiences. It's very important to sharing the understanding. It's very important to uh, create some commonness where people can share their feelings. It could be using technology, but the important thing is how people can uh, demonstrate their action either by technology or face-to-face interaction. And uh, finally, I would say that post-pandemic situation, I don't know when post-pandemic situation will start, because now second wave is going on. Experts are telling that third wave can start again. So where will it stop? We don't know. You see that the world is you see the uncertainty is uh, very strong than ever before. We don't know what will happen tomorrow morning, and uncertainty drives us to frustration. We need to overcome that frustration, and overcoming frustration requires mutual understanding, mutual respect, collaboration, and showing respect to the community. Otherwise, uh, this post-pandemic situation could bring a lot of uh, uh, problem in the society, and you see people may not trust each other, and people can demonstrate their too much sensitivity to each other. So I would say that we have to uh, create an environment where people can think together, where people can uh, think their concern together, where people can stay together, where people can be kind to each other. That's the bottom line. Thank you.
Thank you, sir. Before I let you go, I have a quick last question to Dr. Dahal. I wanted to ask you that. I mean, we already talked about how this has a toll on our mental health as well. We are getting so impatient. We are not in the same. We already deal with our life problems. Like even without COVID, we had to deal with a lot of problems every day. On top of that, we have COVID, and it definitely has a toll on our mental health as well, on our patients as well. On top of that, people are not really following. We see a lot of people, they're not following what we should follow to be safe. So I wanted to ask you for your last note on how we can build or create more awareness and through communication, so that even thinking about long term, like how we can better create the awareness so we can handle um, on the mental health as well. On the other side, we still need to work on how to be better, how to be safer. Um,
Yeah, thank you. Yes, this has been now. I think the reported toll on mental health issues during this pandemic has been rising, and there's been this is a big concern, and I think that is why it is very timely to discuss about the human, like aspect of communication and this pandemic situation now. I think one way, the only way to overcome a mental crisis as suggested by the mental health experts, is to talk, and talk and express. And maybe we have so many different avenues to talk. And as I talked earlier about, like strategizing our communication approach, and evolve, making it evolve out of this pandemic crisis, would be a solution towards it. Like maybe to talk, but to have a very meaningful talk, maybe a very empathetic talk, maybe understanding talk, and not only talk but more listen to than talk. Like listen to others. And the the human life actually from past several decades have been in a kind of a in its own roller coaster ride. So we had so many things coming up, so many innovations, so many like aspect, so many inspirations, and we're all running and running and the running, uh, and I don't know for what we're running, and even without realizing we are running, we're still running. So maybe in that fast run for the achievement, like, and sometimes we even fail to define what we are achieving for, or what would be the achievement. And somebody sometimes reminds you on the middle of the way that yes, you have achieved something. Maybe they will like acknowledge that by giving you the award, but you will still not be satisfied. You want to have more achievement even without realizing that. So maybe this fast paced running was a reason behind like this rise in the anxiety among human. And even sometimes feel, I might be completely wrong, but sometimes I feel that, was that a real anxiety I was going through, or was that a reminded anxiety or mediated anxiety? Yes, this is these symptoms you have, and it's called anxiety, and this is called the mental health. Uh, One aspect of looking into that is that, but the today's situation is not that. It's a very like complex and very serious and a grave situation. And this situation has brought in so much alienation, as we've been discussing from past 1 hour, about how much alienation that it has brought in. Particularly the professor has like given so many examples of how society has been kind of building its own like mountains of mistrust. And then that will convert into a kind of, that will, the fear would be that that might solidify as a stigma. And then it will be very difficult for a society to do that, to break that stigma and come out. And the way out would be to talk about that. We should not stigmatize. Like I even in Nepal, I was reading in the newspaper this morning that like as somebody was writing saying that, as we know more and more people are being infected, like the more and more information of the infections are coming through, so let's not hide it. Let's not hide it. Let's not hide it, not only for us but for the betterment of others. So I think that would be the right attitude, or that would be the right approach. We talk about like kind of like talking about the mental health issues, like, so how alienation and isolation is adding adding negativities to the human psyche, and that might result into a very unwanted situations for us to like overcome this anxiety. So communication definitely plays a strong role, as we have seen. A lots of like toll free hotline number has been established in Nepal, and people are taking a very proactive approach to help people who are in the need to talk about the mental health issues. And as we've been discussing about the isolation, like first it was a forced isolation that was there. We called that a lockdown everywhere, but now that strict lockdown are not there, but the isolation is still there. Like, and then isolation turning into stigmatization through this like distancing. And then this distancing is harmful for the like maybe a natural human thinking. So this disruption is not only physical, but this disruption might as well be a mental. So if that would be the case, slowly started seeing how this isolation and this alienation has been affecting or having a very detrimental impact, especially among the young population, working population. And if you go to the more to the bottom of the pyramid, you find it more for people who has to survive on like daily wages, as they are completely cut out from their jobs, as they are losing their these informal sector jobs because of this COVID. So more and more mental health problem would come to the fore, and this would be the time where the government, who is in charge, or who has taken oath, who has taken an oath to protect its citizens, people, and the government in the democratic society, they claim that they are for the people, and they are elected by the people. If that is the case, and then if that is the meaning of the democracy, it is the right time for the policy, like makers, to come out, and not to think about their own little petty political interest, but larger human interest, and that would be a solution. And as a communication scholar, what I can say, is that there are ways where we could design human centered, effective communication, where we could show the affection and the care, and focus on the mental health issues that this alienation might aggravate. As you've just said, that the like the the issue was there about the anxiety and the achievement and the progress. That issue was detrimenting, or that was also detrimental to the mental health of the society, or the mental health of the people. But with this alienation and with this pandemic, I think it has aggravated more. And the only way to overcome is to talk, and the communication tools or the communication would be instrumental in that.
Thank you, Dr. Dahal. I hear a lot of echoes from both of you that we need to show more empathy to each other. We need to hold on to our sense of community. And I totally agree with Dr. Mansur sir. You said that this online communication cannot really replace the face-to-face communication. This is only an ad hoc solution. So we need to know, and as Dr. Dahal said, when we talk, we probably need to focus on, maybe it's time we have a deep talk rather than just, even when we're talking online, we need to have a deeper conversation, so that we still can hold on to our sense of community, and not be much more individual. Thank you both. It has been my pleasure to have a conversation with you. Thank you for joining us and giving us your precious time. Thank you.
Yeah, thank you very much for giving me this opportunity to talk, and I hope I've been able to talk some sense in this very difficult time. Thank you very much.
Thank you.
And Mumtahin, thank you so much for engaging us in this important discussion. And finally, I would say that it's very important to communicate, to satisfy our need, to reveal our feelings, to share information, and to accomplish a host of purposes. And communication is very important tool to reach out other people. And that's the way to resolve the problem. And that's the way to mitigate the problem. And I'm pretty sure people think about reach out more people during the time of this crisis. Thank you.
Thank you.